Yeah, hi, I'm Keith Gerard. I'm a senior correspondent with AllBusiness.com, covering the small business space. And we're here today to talk about small business and healthcare reform. And I know that healthcare and small business have been a flashpoint in the debate so far. So I was hoping you'd kind of tell us exactly how this will now benefit small businesses specifically.
Sure, Keith. First, thanks for hosting this. We've been very anxious to try to reach out to a lot of small businesses around the country because we know, for one thing, they're working hard, making payroll, and don't have time to come to meetings in Washington. We're hoping that they could hear this today, listen in, watch this, and learn more, and actually go to our website as well, which is www.healthreform.gov, to learn more about how health reform will help small businesses. So I'm the director of the Office of Health Reform here at the White House, and with me is Mark Duggan, who's a senior economist at the Council of Economic Advisors and who does a lot of our work around small business. So I think I would start off by saying first, we know that small businesses are worried, and they have every reason to be. The status quo when it comes to health insurance is really not working for small business. We know that about a quarter of the uninsured, around 11 million people, are employees of firms with fewer than 25 workers. We know that they're finding it harder and harder to offer coverage because of rising costs. We get a lot of letters from small businesses who say that. The percentage of firms employing less than 10 workers declined from 57% to 46%. We know that is out there. We know that small businesses pay about 20% more for health insurance than big employers do. And we know that an employee of a small business is about 50% more likely to lose their job-based coverage than an employee of a large business. So with our health insurance reform, what we want to do is try to lower costs for small businesses. And we believe that the bills that Congress is considering right now will do that. And how do they do that? Well, first of all, small businesses will have access to what we are calling an exchange, which is really just a way of saying that we're going to pool small businesses together and individuals together who right now are out in the market trying on their own to buy insurance, going from broker to broker. We know how hard that is, and this pool will help increase access to more choices for them and lower their administrative costs, because some of them right now tell me they have to have a full-time person just trying to call brokers and keep up with all that. So they'll have an easier way of purchasing. And we believe that the estimates we've seen is that some small businesses could save as much as 25% on premiums when this thing is fully phased in. So we think that'll be a big help. Most small businesses would be exempt from any requirement that they participate in this. So because of their size and relatively small payrolls, they won't have a requirement to participate. But those who do and who want to offer, we think should get lower costs. We think they'll have more access to more choices, and they'll also have access to some tax credits to help them afford it. So that, in a nutshell, is what we're trying to do.
Sounds excellent. Now, one thing we did at All Business was, I know small business owners have been clamoring for details, so we went out and put together some case studies, and I think we forwarded them to you. And it'd be great if you could kind of address some of these case studies and answer some of the individual concerns that have been raised for small firms.
Yes, and we really appreciated your doing that, because we do find when we talk to the trade association heads or whoever, they say, well, people want specifics. So you gave us some specifics, and we're going to try to answer them. So one of them is from, is it okay if I mention the names?
Oh.
I guess
yeah, sure.
they sent it in.
Yes.
Helen Dean, who owns a company called Toy Safari in Alameda, California. And I was teasing earlier, I think I probably have ordered from Helen if she has a website, because my two boys like to order toys from the web. She has 5 full-time equivalent employees now. Her average annual wages is around $20,000, and she currently pays for coverage. She offers coverage, which is great, and thank you for doing that. It averages around $350 per person per month. She said her rates have gone up about 7% a year in the last few years, so she's clearly facing this. And she says that she has some workers who are over 50, and we know that that helps to drive the cost up, because people who are over 50 use more health care. She said that she hasn't hired people over the past couple of years because they would need insurance. So the fact of having to afford insurance, health insurance, has prevented her from hiring. And that's something that we really see a lot, is that there are small businesses out there who could grow, who have good ideas, or people who would like to start small businesses, and they can't just because of the cost of health insurance. And she said, I'm limited in hiring people I need to cover health insurance. And she also said, I'd love to insure all of them, but I have to rely on parents' insurance to cover the students and spouses' insurance to cover married employees. So she's struggling to keep this going. So how would this help her? And Mark and some of his colleagues helped me to go through this and figure it out. So first of all, she would have a tax credit to pay for health insurance. She, by the way, would not be required to do anything. She's not required to now. She's doing this, presumably in Alameda, this is what she wants to do to help attract good employees. She wouldn't be required to. But she can, if she continues offering, she'll get a tax credit because her firm has fewer than 25 employees and an average annual wage below $40,000, she'll be eligible for that. So if anyone's listening or watching who has a similar size business, you'd be in the same position that Helen would be. So the Toy Safari would be eligible for a small business tax credit of, it depends on the House or the Senate bill, but to help pay for coverage under their proposals. In the House, she'd be eligible for 50% of her costs, the coverage costs. In the Senate, it's a little bit less, but it goes up to 50% after 2013. So, you know, there's quite a bit of help there that would be available for her if these bills pass. Another thing that would help her here is that she mentioned that she has workers whose age helps to drive up the cost of insurance. Both the House and Senate bills prevent insurers in the small group market from charging higher premiums based on health status, and they limit the premium variation based on age. So that means that you will no longer be required to pay higher health insurance premiums because of one or two workers with comparatively higher costs. And then thirdly, she should get lower cost and lower premium growth rates if she decides to go purchase through the exchange, which will be available to her. She mentioned that her rates have increased significantly over the past few years, and this reform will allow the Toy Safari to pool together with other small firms and purchase coverage as a group through a competitive health insurance exchange. Right now, small employers face higher costs because of higher administrative costs because of the agents out there selling to them. And so we think this could be about 23% of premiums compared with a much lower amount for larger firms. So we think that'll result in a lot of savings for her as well. And then finally, we think that this will help her be more competitive in hiring workers. She mentioned that high health insurance costs have prevented her from hiring new workers. Under reform, people will have access to high quality, affordable coverage through the exchange, meaning that she'll compete on a level playing field with other firms that offer benefits and attract and retain talented workers. And we hear that from small business a lot. So we think it'll be helpful to her. Do you want me to go through another
Yeah,
case
if you like,
study?
maybe one more would be
I have
interesting.
one more
I think that really sheds
here.
a lot of light on individual and specific
Yeah,
cases.
and again, if you can, we'll try to put these examples up on the website and you'll have them as well. And I think it would help if people see the numbers and how it would affect them. So this second firm is quite a bit different from the Toy Safari. Keith, this is a firm called Mowat, Mackey and Anderson, which is a CPA firm also in California. And the information was submitted from their firm administrator. They have 40 full-time equivalent employees, and the average annual wages are quite a bit higher at $45,000. They are currently offering coverage, and that's typical for an accounting firm with wages of this level. So she says they're currently offering coverage, and employees pay 20%, and the employer pays 80%. Her rates have gone up a staggering amount in the last few years. She says an average of 28%. So she's seen a lot of increases. She believes she has some workers whose health or age is driving up the cost. It's been a problem for them in hiring more workers or expanding their business. So one thing that we'd note right at the beginning is that she mentioned that she's had some workers whose health or age has driven up the cost. The adjusted community rating that reform makes possible will help to prevent higher rates for older or less healthy workers. So that should help her right off the bat with the premium variation. I should note too that under one of the bills, she would be subject to having employer responsibility and be asked to contribute here. Under the other one, she probably wouldn't. So that's still something that's being worked out. She's already doing it, which again, we appreciate that she's actually providing insurance. We believe that reform will enable her too and her firm to purchase through the exchange, and as purchasing through this competitive exchange will help her lower her cost, as much as right now it's about 23% of her premiums, the administrative costs, so we expect that to fall quite a bit. As well, we also know that all of us are paying a hidden tax right now of higher premiums that you pay on behalf of the people who don't have coverage, who show up in the emergency room. So that'll be a factor in lowering the cost as well. As I said, she already meets the employer responsibility requirements that might be there in the House bill. Under the Senate bill, we think she probably wouldn't even have a requirement to participate, but if she wants to continue participating, she'll be eligible for the tax credits that I mentioned earlier. Do you want to add anything, Mark, to this?
Right, sure, and I think just to sort of build on what you've already said, to the extent that these small businesses are able to get health insurance for lower prices, lower costs, that's going to translate into either higher wages for their employees or higher profits for their businesses. And so it's going to really, or some combination of the two. So we think that it's really going to be a great benefit to small businesses throughout the country.
Sounds good. Now, obviously, everybody has their own specific questions, and including myself, and I didn't want to have all the fun here. So we actually went out and asked our readers to submit questions and got a surprising response, a tremendous number of questions. And what I did was pick the ones that were representative of all the questions. I'd like to just kind of go through a few of those with you and have you respond specifically to individual concerns. And I'll just read from here if I can. The first question, one question was from Thomas Sushan of Bear Cooling and Heating in Las Vegas. And he asked, I keep hearing frightening figures about what the bill will cost, but cannot find figures anywhere on what we are all paying now into health care insurance versus what we will get back, so that I can make an enlightened decision. And if you could sum up exactly that
That's
point.
a great question, and I'll tell you the numbers I hear that are frightening are the ones about what happens if we don't do anything here, where people are going to be spending, $28,000 a person for insurance in a few years down the road. As far as how much we're spending today, that's an excellent question. People rarely focus on that, but it's actually around $2.5 trillion in our country that we spend annually on health right now. So what we're talking about is spending, it's probably around $100 billion a year to get everyone covered and to create this exchange which will lower everybody's costs. And we think there's a number of ways that your costs will be lowered. One that we've emphasized a lot is this exchange or pooling mechanism so that you can purchase with much lower administrative costs and have better choices. Secondly, there are a lot of reforms to the delivery system in these bills that will help us to get our care in a smarter way, do things like reduce the readmissions to the hospitals that often occur. Within 30 days after someone checks out, they get sick again. So creating incentives for providers to take better care of people. Those things will be big. The administrative savings from this, all the experts who've looked at it think those can be really huge numbers on the current spending. So all of those things we think are going to lower costs.
Good. On a more micro level, a question that was recurring was, what is this going to cost to me individually? And Steve Benish of Magic Car Wash in Sheboygan, Wisconsin, probably summed that up best. He said, I own a business with 16 employees, but with sales less than $500,000 a year. Am I going to be required to purchase health care for my employees, which I cannot afford? And will I be penalized if I don't?
Right. Well, for most small businesses, and I believe his certainly would qualify, there won't be any employer responsibility requirement. Some small businesses, at least one of the ones we talked about today, are providing now, and if they want to continue offering coverage, their costs will be lower, they'll have access to the exchange, and they'll get the tax credits to help them. But there won't be a requirement that most small businesses participate in this. It's really only when you get to a larger payroll and a larger number of employees.
Right. Another question sort of related, I know we touched on this a little bit, was how will it affect the health premiums that people are already paying? And Raju Jiram of MBI Consulting in Fort Collins, Colorado asked, I'm currently paying premiums for my health insurance. Will the health care reform increase the premiums I'm paying? And will my coverage increase or decrease?
Well, we think that based on everything that we've seen and all the experts have looked at, that their costs should be lowered. So first, if you like what you have, whatever it is, if you have a health insurance plan that you think works for you, under these bills it's going to be what we call grandfathered, meaning that you can keep it. So if you like the plan that you have, you can keep it. The only change should be that over time, your cost should be lowered as we do some of the delivery system reforms in Medicare and the other programs that we think are going to lower cost for everybody. And the other good thing, Keith, that just can't be overemphasized is that let's say you have something you like right now. That's great. You can keep it under reform. But let's say you decided, I want to go start a small business, or or you decide, or you were laid off from your job. After reform, you will be able to go purchase insurance in the exchange, and it'll be more affordable to you. If you're low income, you'll have access to subsidies, premium tax credits to help you purchase it, and it will enable you to have that peace of mind. I mean, pretty much anybody over the age of 30 in this country, right now, if you try to go in the individual market, you could have a good chance of being locked out or finding it very difficult to purchase because of a pre-existing condition. This has happened in my family,
Sure.
May have happened in yours. So that's a benefit of this reform for people who, even if you currently like what you have, your costs should go down, you should be able to keep it, but if you wanted to change, if you want to go start a small business, you'll be able to do that.
Okay, another question, obviously, it's been heard and bandied about in the news a lot, is the effect on Medicare and Medicaid. And we had a question from Lisa Gendron of New Hudson, Michigan. And she asked just simply, how is this bill going to affect Medicare and Medicaid? With this drastic cut in money, will a lot of services be cut? And that's an important issue that's been confusing to a lot of people.
It has been confusing, and the answer is no. And in fact, the ARP, which endorsed the House bill, said there's not going to be a cut of benefits for seniors. In fact, what's so frustrating to me, Keith, is that seniors' benefits are going to be strengthened in a number of ways. One way is that the Medicare Trust Fund, through the changes that are being made to improve Medicare's solvency, will be strengthened and preserved an additional 5 or 6 years under these bills. So right now, Medicare's facing a loss of solvency in a few years out, and this is really strengthening that, extending the life of Medicare. Also, what's called the donut hole for seniors, which is when they get to a certain level of prescription drug spending, they have to spend pretty much all their own money because there's a gap in their coverage. That's going to be closed under these bills. So that'll be a big benefit for them. We are doing some things to reduce fraud, waste, and abuse in Medicare. We're bringing the additional rates paid to insurance companies under the Medicare program down somewhat to make it more efficient. But we think this will strengthen the Medicare program.
Excellent. Another question, and coming back to costs again, a lot of people are looking for specifics, and Craig Phipps kind of summarized the sentiment from Oklahoma Employment Security Corp in Oklahoma City when he asked, what specific provisions are there in the bill that will act to slow and maintain some control over health care costs? The specifics.
Well, I'd start with the fact that everyone right now, whoever you are, you're paying a hidden tax of around $1,000 a family if you have insurance to cover people who don't have it, who go to the emergency room, who wait until it's very late in an illness to get care. So that's one thing that'll be gone under reform, and that'll be savings to everyone. Secondly, the exchange and being able in the individual and small group market to go in and purchase insurance easily without the high administrative costs that have been there before, without the pre-existing condition exclusions and all the underwriting and everything. That's going to produce a lot of cost savings for small businesses and for everybody. Thirdly, there are going to be delivery system reforms in the bills that will incentivize providers to take better care of people, to bundle payments so that they're taking care of someone for an entire episode instead of sort of the piecemeal way they do it now. And the experts who have looked at it see that there'll be savings from that as well. And finally, there are other provisions in the bills that will lower costs over time, including some revenue provisions. So we think there's every reason to believe people's costs are going to go down under reform. And we do know that without reform, as I said, we're looking at a pretty bleak picture here, both from a family perspective and a business perspective.
One other question that's come up a lot, and I don't think we've quite touched on enough, is a lot of people, maybe 80% that do have health care, are very happy with their plan right now. And so we've gotten a lot of questions about how the reform will affect the quality of health care. And just to give you an example, Greg Kahn of SD Hospitality and Supply in San Diego, California, asked, he wondered how this plan can save money by denying care, paying doctors less, whether that's true or false, and whether this will create disincentive for people to become doctors, and whether this will kind of erode the quality of health care. So just generally, what do you see in that sense, how it will affect the quality?
I'm glad you asked that,
Yeah.
because we do see a lot in here that will improve quality. There will be new emphasis on quality standards and requiring providers to meet them. And let me tell you something, Keith, doctors support this. The American Medical Association has been very supportive of getting health reform done. Many specialty societies, pediatricians, and others have all said this is what needs to happen. Mm-hmm. There will be also efforts in the legislation to improve the healthcare workforce and to strengthen it and to make sure that we have plenty of clinicians, both physicians and physician assistants and nurses out there to meet the demand. I just want to highlight one number too from John Gruber at MIT, who's one of the economists who has studied this, says that he sees enormous reduction in small business spending through healthcare reform. In 2019, absent reform, he estimates that small businesses will spend about $290 billion a year in health insurance premiums, and those are just the ones who currently cover. Under reform, he sees that number falling by about 25% to $225 billion a year. He sees an increase in the take-home pay of small business workers of almost $30 billion a year. And that reform would save about 80,000 jobs in the small business sector by 2019. So it's not just me saying it, there are also out there economists like Mark who've looked at it and see a lot of benefits for small business.
Excellent, excellent. Well, I really appreciate Nancy Ann and Mark both your time and effort to meet with us and trying to clarify some of these issues. It's a historic bill, a historic vote, and hopefully we'll see some real positive change out of it, especially for small businesses.
Great, and we hope we'll continue hearing from small businesses, and Mark and I have talked about trying to put some more information up on our healthreform.gov website, and we'll keep working with you, Keith,
Excellent.
too, to get the word out. Thanks.
Excellent. Okay, thanks very much.
Thanks.